Hi everyone. Today I'm going to be talking about breast cancer in Canada and comparing it to the United States. Breast cancer is one of the most common cancers affecting women worldwide, and it's a major public health issue because of how many people it impacts each year. In this presentation, I'll cover an overview of breast cancer, who it affects, risk factors, how each country's healthcare system responds, and some of the major challenges and recommendations for improvement. Overview. Breast cancer is the most commonly diagnosed cancer among women in both Canada and the United States. About 1 in 8 women will develop breast cancer at some point in their lifetime. In Canada, there are over 30,000 new cases each year and thousands of deaths, although survival rates are relatively high at around 89%. This is largely due to early detection and effective treatment options. Breast cancer mainly affects women over the age of 50, but it can occur in younger women as well. Some individuals are at higher risk, especially those with genetic mutations like BRCA1 or BRCA2, a family history of breast cancer, or certain lifestyle risk factors. Risk factors include things like alcohol use, lack of physical activity, obesity, hormone exposure, or environmental influences. Access to healthcare and screening also play a major role in outcomes, which is why this becomes an important public health issue. In Canada, the healthcare system is publicly funded, meaning that most medically necessary services are covered for all residents. This system helps reduce financial barriers and allows more people to access the screening and treatment needed. Canada has strong breast cancer screening programs, especially mammography for women between the ages of 50 and 74. These programs are key to early detection, which significantly improves survival rates. However, there are still challenges. One major issue is access in rural and remote areas. People living far from healthcare facilities may have difficulty getting screened or receiving timely treatment. Another challenge is wait times. Even though the care is available, delays in diagnostic testing or treatment can impact outcomes. Overall, Canada does well in providing equitable access, but there is still room for improvement, especially in reducing geographic disparities. In the United States, the healthcare system is quite different. It is a mixed system that includes private insurance, employer-based coverage, and government programs like Medicare and Medicaid. One advantage of the U.S. system is access to advanced medical technology and specialized care. Patients can often receive diagnostic tests and treatment more quickly than in Canada. However, access is not universal. This means that not everyone has equal access to care. People without insurance or with limited coverage may delay or avoid screening and treatment because of cost. This leads to significant health disparities. For example, lower income individuals and certain racial or ethnic groups often experience worse outcomes, even though the overall quality of care in the U.S. is very high. The challenges and recommendations. One of the biggest challenges in both countries is health inequity. Even though Canada has universal health care, people in rural or underserved communities may still face barriers. In the United States, these disparities are even more pronounced due to cost and insurance differences. Another major challenge is misinformation. Many people receive inaccurate information about breast cancer screening or treatment, though through social media or other sources. This can lead to delays in care or poor health decisions. To improve outcomes, there are a couple of key recommendations. First, expanding access to screening in rural and underserved areas is critical. This can include mobile mammography units or telehealth services to connect patients with specialists. Second, increasing education and awareness is essential. Public health campaigns can help people understand their risk, the importance of screening, and when to seek care. Overall, improving access and education can lead to earlier detection, which is key, better treatment outcomes, and reduced disparities. The discussion questions that I have: how do you think having a universal healthcare system like in Canada versus the insurance-based that we have in the US impacts early detection and survival rates for breast cancer? And then number 2, what are some ways public health professionals can reduce barriers like cost, location, or misinformation that prevent people from getting breast cancer screenings? Thank you.